Good evening, and I welcome you to the Power of Information COVID-19 Vaccines, Facts, Fears, and Faith webinar. My name is Ida Johnson Dawson, and I serve as the president of the Raleigh chapter of Chums Incorporated. These informational sessions are being brought to you by a coalition of community organizations to include the Phi Lambda chapter of Alpha Phi Alpha Fraternity Incorporated, the Raleigh chapter of Chums Incorporated, the Raleigh chapter of Delta Sigma Theta Sorority Incorporated, and the Raleigh-Apex chapter of the NAACP. Tonight's session is being hosted by the Phi Lambda chapter of Alpha Phi Alpha Fraternity Incorporated and the Raleigh chapter of Chums. In the first session, we explored the science and heard from medical experts about the pandemic and its burdens on medical systems, as well as economic and social impacts on communities, particularly communities of color. In tonight's session, we will hear from community leaders who will talk about the impact of people's fears to taking the vaccine. Many of these fears are founded on historical events that have negatively affected the Black community. They will also address some of the misinformation that has been circulated in the community to help people make informed decisions. Before the panelists begin, I would like to ask you, if you have questions, to type those questions into the Q&A panel, and we will try to have them addressed by a panelist as the meeting progresses. At this time, I would like to introduce you to this evening's moderator, Mr. Eddie Lambert, who is president of the Phi Lambda chapter of Alpha Phi Alpha Fraternity Incorporated here in Raleigh, North Carolina. Mr. Lambert.
Great, thank you. I appreciate that. Welcome everyone to the second in our series, The Power of Information, COVID-19 Vaccines, Facts, Fears, and Faith. Of course, last month we had a discussion around facts, had some great panelists, some medical professionals that did a wonderful job. Tonight we'll be discussing the fears surrounding the COVID-19 vaccine. We have a great panel of representatives here representing the community. You'll notice here this time that while we do have a medical professional, we do also have some great members and outstanding members of our community. First, I would like to announce that we have Dr. Charles Cook, MD. He is the president and CEO of the Associated Medical Specialists. He has been practicing for 38 years with a private practice. His expertise includes public health, nephrology, business, and he is also a decorated Purple Heart veteran. Thank you for your service, Dr. Cook. We also have Coach George Williams. I'm sure, again, many of you know him. He has a 44-year coaching career. He ranks among the winningest coaches in NCAA history. 23 years. He was athletic director for 23 years at St. Augustine's University. You might also notice he has that nice looking USA pin. He was a USA Olympic head track coach in 2004. As he and I spoke, we also know that we have a few folks in common that he even coached. So thank you, Coach George Williams. Last but certainly not least, we have Mr. Greer Webb. Mr. Webb is a Moorhead and Kane Scholar at UNC Chapel Hill. He is the co-chair of the UNC BSM Political Action Committee. He is also a commissioner at large for the North Carolina Governor's Crime Commission and co-founder of the North Carolina Town Hall and Young Americans Protest. Again, the purpose of tonight is to help you get more information, accurate information around the fears for this COVID-19 vaccine. It's not to tell you one way or the other whether you should take the vaccine or not. But again, the goal is to help make sure that you have accurate information so that when an opportunity does arise for you to take the vaccine, you can at least already know what you would like to do. Now, before we begin, I would like to post a poll right here. So go ahead and let us know what you think. Today, how confident are you in making the decision on whether or not to get the COVID-19 vaccine? We'll give you maybe 30 seconds to make that decision. Okay, IT, we can take it down. Okay, now let's move to our first question. Question number one, panelists. Are you planning to get or have you already received the vaccine when it's available to you, and what's driving your decision? Let's start with you, Coach Williams.
Well, I've already had my vaccines. I've had both of them, the 1 and 2. And what drove me into taking my vaccine is that I know there's been a lot of misconception about what it does to you and what, but I trust doctors and nurses. And maybe 40 years ago, I probably had a second thoughts about it because we didn't have that many doctors and nurses of my color and in my community. But now we have a lot of doctors and nurses that I trust, and trust has always been an important factor in my neighborhood. And when you have a person like Dr. Cook, who's always been a leader of the community, and I'm quite sure he's been very adamant about taking the vaccines. But there's still some questions with the young folks, but I've had mine, and thank you, and I'm doing quite well, very well.
Excellent, excellent. Thank you for that response. Speaking of Dr. Cook, what are your thoughts? Have you already received the vaccine? And if not, have you made a decision on whether you will take it?
Well, yes, thank you for the question. I have received my vaccine. I received the Pfizer vaccine. I received both doses. I had extremely minimal side effects. And there are multiple reasons why I would take it, but just to articulate two of them. One is that if I'm going to be in a war, I want to be properly equipped. I want to have the proper armor. I don't want to be a dereliction to my duty of taking care of my patients because I'm afraid for me. So in taking the vaccine, it offered me a specific level of confidence in the fact that I could take care of my patients with or without COVID-19. And of course, we know that there's you just can't tell who has it because there are asymptomatic carriers that look as good as anyone, but who can pass it on. So it was my responsibility to the public, to my patients, to make sure that I got the vaccine. The second reason, again, among many others that I could give, but very briefly, is that my patients look to me, and if I'm a leader of their healthcare, and they see that I'm afraid of it, then they're going to be afraid of it. So as an example, if you will, of the confidence that like Coach mentioned, we do have data, we do have information. Yes, we do have doubts and reason for doubts, but right now the most important thing is protection and survival. And we see that in fact this disorder, this disease, has wreaked havoc in our community. And I like to say that survival is more important than anything else. You cannot come back and wish that you had done something.
Great, thank you. Greer, what are your thoughts? Have you decided if you will take the vaccine? I'm going to go out on a limb that probably you have not had the opportunity to take it yet. So let's hear your response.
That's correct. First of all, thank you to everyone for having me on the call tonight. I have not received the vaccines yet, but when I become eligible, I definitely plan on taking them, receiving them. And my reasons are similar to not only Coach's, but Dr. Cook's as well. I believe that it will not only protect me, but those around me, especially those of color and especially the older folks in our community. And so I do plan on receiving the vaccines when I become eligible.
Okay, excellent. Thank you. Okay. Question number 2 for the panelists. Let's put this question on the table for you. You've all heard about the Tuskegee experiment. and obviously the distrust that Black folks have when it comes to taking vaccines. Based on that historical experience, how do we get Black folks to at least consider taking the vaccine, or at least being willing to even get the proper information so that they can make a choice about taking the vaccine? This time, let's start with you, Dr. Cook.
Thank you. I have had many opportunities to have a discussion about the Tuskegee Institute, the Tuskegee experience, I should say. And as a member of the medical community, it pains me to know that event occurred for the reasons that they occurred. It is not without evidence in the Black community that we have been subjected to many, in some instances, unethical or malfeasance in medicine. I think we can take a look at studies, for instance, that was done over at Duke, just looking at how Black patient was treated with the same presentation compared to white patients, and Black patients are treated differently. And so they go on to have their heart attack and their strokes. So we're not just talking about the experience of Tuskegee some years ago, we're talking about a daily experience that we have to cipher through and decide what's best for us. And so my question that I usually ask when I have my discussion with my patients is this: you're at a decision tree. And the question is, do you want to survive? Do you want to live? Or do you want to hear about the side effects potential? And again, let's get beyond the confidence. I'm not disregarding the Tuskegee experiment at all. But to make it more rudimentary, to understand, if I'm driving on a road and I have to avoid an accident and there's a cement wall to my left and a patch of bushes to the right, which one am I going to choose to run into? Okay. I think that a level-headed person would choose the bushes rather than a cement wall. And so I won't say in spite of, but with the knowledge that the Tuskegee experiment was in fact unethical and unthinkable, today we still have to face the fact that there is that decision that we have to make on a daily basis. And it's not just the Tuskegee experiment. Let's make the right decision. You can come back and do stuff if you survive. If you don't survive, there's nothing to do. And my grandmother used to say, and I hate to put it in this term, but it was so plain, and I've lived by it all my life. She used to say, if you're dead, you're dead. There's nothing else to do. So my thing is that, yes, the experiment was horrible, but we're faced with the real life issue of survival. And so many in our community has not survived this event, has not survived this disorder. So let's get in the best position to do so. That is my position, even with those things such as Tuskegee in the background.
Thank you. Thank you for that response. Greer, I know the Tuskegee experience was quite some time ago, but experiment, I should say, but let's go ahead and get your thoughts.
Sure, I'd love to. I agree wholeheartedly with what Dr. Cook was saying, and I just wanted to read this out, something I came across on Twitter earlier. It just says, Black people are not scared of the COVID vaccine. Black people are not afraid of trees or ropes. However, we do remember what white people have historically done with them. And so that notion is completely understandable, of course, when we talk about the Tuskegee experiment, but also Henrietta Lacks and the experiments that Dr. J. Marion Sims did upon enslaved women. However, we also know, as Dr. Cook was stating, the data. We also know that this virus has been studied by Dr. Kizzmekia Corbett, who went to my and studied, got her doctorate at my college, my university, UNC Chapel Hill. And so she is a Black woman, and we do, or at least I do, put trust in her. And so I understand the data I've seen some of the returns, and it has been fruitful and beneficial. And so when we look at protecting not only ourselves, but communities of color and, of course, older folks around us, it's important that we take that history into account. But I do believe that these vaccines are necessary in not only our survival as Black people, but in making sure that we are around to create and continue to contribute to thriving and successful communities.
Thank you. Yeah, thank you for mentioning Dr. Corbett. As you well said, she is a native of North Carolina, so we appreciate that. Coach Williams, what are your thoughts around this?
I kind of agree with the Bria and Dr. Cook, but this Tuskegee experiment, I've read a lot of things about it, and I kind of grew up, and I knew that there was a virus, and it says that they gave the virus to us. But I thought in another part, and I might be wrong, but I heard that they held the medication from us, and they did not did not give us the medication that we needed to cure the virus in which we had in our community at that time. And it's almost like the same thing now. We have the medication, but other people are infiltrating in our neighborhood and getting our medication from us and not giving us the time to get the medication. We're running out of medication because of the fear of what the medicine might do to us. And now with the Tuskegee experiment, Dr. Cook might can help me with that. I don't know whether they were giving us the disease and withholding the medicine, or whether they just withholding the medicine from us when they had it. Instead of giving it to us, they kept it for their own community. I don't know, but that's something I'm still trying to work out in my mind and my reading. But right. One thing I do know, that we have the medicine now for this virus that we have out here. But if we don't trust the virus, I mean the medicine and the people to give us the medicine, then we're all going to be kind of like the Tuskegee experiment, because we're thinking somebody else is going to use the medicine that is for us. And the people who are using the medicine and coming in our neighborhoods are not the people that have the skin like ours, okay? Mm-hmm. And so what we got to do, we got to make sure that our community is taken care of. And thank God for a person like Dr. Cook. Because see, I learned a long time ago that God didn't make winners and God didn't make losers, but he made choosers. We got to make the right choices. And the right choices now is to take the medication, the vaccine that they have for this virus.
Okay. All right. Thank you. Well, I will say this real quick. Dr. Cook, feel free to correct me, but I do not believe that it was that they were giving the disease to anyone. I think they were probably withholding the medication for it as they were studying how that disease would affect people. But Dr. Cook, feel free to correct me on that. I don't want to go too long on that topic, but I don't want any misinformation to be out there around that experience.
Yes, and you're quite right. And it's very important to get the story correctly. What was done was diagnosed syphilis. It was actually syphilis, which is a paravirus, but it's more like a bacteria, was indeed diagnosed. And instead of treating it, and believe it or not, it was something as simple as penicillin. Penicillin was very, very, very active against syphilis. Even one shot or an oral dosing, several oral dosing would have cured it at that stage. And what their thought was is that we could watch these folks and see how it progressed over time, how it affect their brain, how it affect the heart, how it affect them mentally and physically. And of course, that is grossly unethical to withhold treatment. And that is what happened. No transmission of disease. They did not give the syphilis to anyone. It was an observational study, which was unethical.
Right.
Thank you.
Right.
Thank you,
And
Eddie.
oh yeah, sure. That's why we're all here.
And that's why I really wanted to make sure, because, you know, I don't want my people to think that one way or the other, because once you think of one way, you lose trust in the other way.
Absolutely. I'm with you, Coach. This question will be, this is our third question. This question will be for you, Dr. Cook, Brother Cook. As you may know, many people in the Black community, including expectant mothers, have concerns about the COVID-19 vaccine because it was developed so quickly. At least that's how we feel. Can you address this question and elaborate on the safety nets put in place for the vaccine?
Yes, I can. I think one of the things that, and I like to use examples. If you have a builder who gathers all of his goods and put at the building site and put up a house in 1 month, because he has all the tools and all the manpower and all of the things that he needs to do to build that house, then one may see it as quick, but he may have spent months gathering his equipment, gathering his manpower, gathering the intricate things that he or she needs to build that house. And so with COVID-19 vaccine, much the same can be said to be true. The actual mechanism or methodology, as a better word, to offer this kind of immunization occurred years ago. And in fact, some of it evolved around trying to find a vaccine for Ebola. And so we know that taking that particular expertise and transferring it into the technical realm, whereby drug companies and scientists could say we can stimulate antibodies by taking that already developed methodology. And oh, by the way, studies are done in phase 1, phase 2, phase 3, and phase 4. And that is a technical decision, and it is expected in the research arena. But why couldn't we run some of those studies simultaneously? Why couldn't we run some of those phases simultaneously? So instead of just doing phase 1 and then analyzing the data and then go to phase 2 and analyze data, they already had the methodology. You do phase 1 and 2 together. You do phase 3, you piggyback phase 3 and right on top of it. So you close the time period down by years that it would ordinarily take to do a study. So by virtue of that, the time was compressed. It wasn't shortened, because if you linked those individual phases together, one after the other, we would have been year, 2 years, 3 years trying to get to the point where we were able to get to very quickly. And of course, this was appropriate because such devastating was expected from this virus that we needed to do the near impossible. And it was done by using this new approach to the studies. So it's not quick. It was just done, and rather than in series, it was done simultaneously, and we got the data and was able to give confidence variables, confidence intervals on how well these drugs would perform. And so far, they performed very well.
Excellent. Thank you. Thank you, Dr. Cook. Now let's go out to our chat group. Ms. Johnson, are there any questions out there from the audience?
Ms. Josephine?
Yes. Our first question is, if you have a compromised immune system, should you take this vaccine?
Okay, well, I think that's an obvious panelist that should answer that one. Dr. Cook, what are your thoughts there?
Well, Yes, I appreciate the question, and there's a very it's a very difficult one to tightrope. But by and large, if you got a compromised immune system, it means that that virus is going to have a playground. That virus will actually be able to impact you more than a person who's able to develop a fight, so to speak, and to generate antibodies, auto antibodies. They're called. Your own bodies make antibodies to the COVID-19. So in my patients, as a nephrologist, I have patients who have had kidney transplants, and they are taking immunosuppressive drugs. I have patients who have lupus, and they are in fact, immune compromised. Patients with rheumatoid arthritis that are taking certain drugs are immune compromised. And so my advice is absolutely yes. Check with your physician. Make sure that you're not vulnerable in any other way. You're not getting a live virus. What you're getting is a stimulation with the vaccine for your body to produce antibodies to the virus that would recognize the virus. So unlike some of the immunizations in the past, or some that's already now available to us, you're not actually getting the virus. You need to be have your immune system more in surveillance mode, and the only way to get it is to get it by getting infected, which you may not survive, or to get it by having your body to develop the antibodies stimulated by the vaccine. So I advise all of my immune compromised patients, again, sometimes in consultation with my rheumatologist or with my immunologist that's working with me on one patient or another, and uniformly the answer has been yes, do get your vaccine.
Okay, great. Thank you. Thank you for that response. Looks like we still have a little more time. Let's go ahead and see if there's one more question before we go back to some of my other questions.
There is another question. This one is directed to Dr. Cook as well. Dr. Cook, many women are now afraid of the vaccine because of information that women are having swollen lymph nodes after taking vaccine and should not have mammograms after that. Can you give more information?
Yes, there is the possibility, and I've just, in fact, on yesterday, dealt with one young lady who had a lymph node that developed under her left arm after taking the shot in the left arm, having the vaccine in the left arm. This is reactive typically, and when I say reactive, as you know, when you get a foreign substance in the body, your body surveils that foreign substance. And if appropriate, it will react to it, whether it's a strep throat or whether it is a splinter in the foot and you get a lymph node in your groin because that splinter has now festered and causing the lymph node to recognize and to try to drain that infection. That is what our body do. It takes care of, it tries to take care of itself. Here, these reactive lymph nodes can be easily taken care of. And the only thing that I had this young lady to do was to use a warm compress for 5 days, and in 7 days, it was gone. Meanwhile, she was well immunized and did not suffer any other adverse outcome from her shot. In fact, she has now scheduled for her second shot. So that this is not a reason to consider not taking the vaccine. There is no data clearly to suggest that this leads to any further event or any further problem. And in fact, it may signal something very different. It may signal your body's ability to mount an immediate response. So it may actually give you a clue that your body's immune system is pretty intact. And whether you're male or female, it really doesn't matter because we now have data on, for instance, pregnancy. We've heard that question come up before. That data very clearly is neutral at worst.
Thank you. Yeah, when I listened to your response, it reminded me of your earlier response when you were talking about a person driving down the highway and to avoid an accident, which way do you want to go? Do you want to veer towards the cement wall or maybe veer towards the bush? So I appreciate that. Thank you.
Mhm.
We have some other responses, some other questions, but we're going to move forward and actually gear one of the questions that came from the audience, but it's really a question that I'd already planned to ask you, Greer. So Greer, obviously here, you more so than anyone else on this panel, you have your hand on the pulse of the younger generation. What do you think needs to be done to get our younger brothers and sisters to have a positive view of at least either taking the vaccine or at least taking the time to get the information so that they can make an educated decision on whether they want to take the vaccine?
I think that's a great question, a critical question, even when we're looking at that 18 to 35 age group specifically. And so I think just to reiterate what both Coach and the doctor have stated earlier tonight, as well as myself, that history is important. I hear from my friends often, especially in college, that they are a little worried and that they do have fears because of the sterilization of Black women, some of the history of the Tuskegee experiment, though different than what's happening now. And that's valid. But I'd also just say to the audience and to those youth that it's still important to get this vaccine. Again, data-driven results. We saw that in the Tuskegee experiment, the data showed that the vaccine or the solution was being withheld. But here we have the vaccine on the table, and it's been proven to help those, specifically people of color, in their immunization. And so when we look at doctors like Dr. Corbett and others who are Black and even Black women saying that, yes, our community does need to get this vaccine and it's proving to be helpful, that's what I reiterate to my friends. And that's what I'm hearing more and more of, that when we are eligible to get the vaccine, we want to take it because we all want to get back to doing what we were doing pre-COVID-19. And that is just not possible right now. And so to my peers, and to those on the call who may be in that 18 to 35 age bracket, it's so important that while we wait on our turn to receive the vaccine, those doses, that we continue to stay masked up, that we continue not to gather in crowds, and that we continue to do what we can to make the most of this time right now, and then to not put others at risk, especially our older community members and our teachers, as they are now eligible to get the vaccine on some level. And so that's how I respond to that question. I understand the fears. I understand the doubt. Like I said, I will be getting the vaccines. But right now, since we're not eligible, we need to do all we can to protect our community and to protect those in the Black community around us that are more at risk for contracting COVID.
Great. Thank you. Thank you for that response. I appreciate it. At this time, I'm going to go back to our chat group, our question and answer session. Is there another question, Ms. Ida, that you would like to read from the audience?
Josephine.
Okay.
Yes. The next question is, for those persons who have had both dosages of the vaccine with no side effects, how susceptible are they to being affected with the virus, if at all?
Okay. Dr. Cook, were you able to catch all of that?
Yes, I was. The percentage goes down tremendously after the first vaccine. All of the vaccines have shown a reduction of susceptibility to the 80-85% range after the first vaccine. After the second vaccine, they climb into the 90s as we've seen with both Moderna and Pfizer. Clearly, that doesn't equal 100%. So there is a small but significant susceptibility that even with 2 vaccines in place, that you can actually contract the virus and be infected by the virus again. We know that individuals who have had COVID-19 can be reinfected. That's been well documented, even though your body produces its own antibodies. And right now, we don't know the length of the protection of either the vaccine or your own autoantibodies. It could be 6 months, it could be a year. It's likely that in fact we'll get into a situation where we'll have a flu-like experience, meaning that yearly or every 2 years we will have to be boosted or have another vaccination. That is not out of the realm of possibility. However, the most important thing to take away from those two study points on the two that we have available to us now, and even now Johnson & Johnson, there has been evidence that there is 100% reduction in death that comes even if you do get infected. So here's your decision tree kind of mode. What do I want to do? Do I want to protect myself, not just on reduction by in the 95, 97% range of getting an infection, but I also am now able to say that by the data, which is consistent with all of the studies, I'm able to virtually protect myself from death from COVID-19. And that's the important piece of the data that oftentimes is not dwelled on. And that is, in fact, you may not be able to prevent infection, but here the data suggests that you'll be able to prevent death from COVID-19.
Right. I agree. Thank you. Thank you, Dr. Cook. Now,
Yes, sir.
Coach Williams,
Yes.
this question will be for you. Coach Williams, you're in a unique position with your life experiences, and you have been grooming young athletes, including, as I mentioned earlier, a family member of mine, throughout your entire career. What are your thoughts on how we can reach these what we would call baby boomers, in our communities, and also younger generations?
Well, first of all, we need to start, with the history and start with what does this virus do for you? See, we don't know what the long range. Young people now are thinking, I'm with them. They catch the virus, they go quarantine for 14 days. The immune system is so strong at a young age, but we don't know what's going to happen down the road. And so we got to find some kind of way to let them know that because your immune system is stronger than your grandmother or your mother and father, which you would take that virus to them if you don't be careful. And like in my world, like the Olympics, every Olympians before they can go to Tokyo on July 23rd going to have a vaccine, or they can't go. And so now I think Americans going to be okay, but I worry about the third world countries. What are they going to do about them? Are we going to have a cluster, or are we going to be okay? But young people are beginning to understand now in my world that if they do not take the vaccine when they're time, if they do not abide by the rules and regulations that we have out there, then their social life is going to become like it is now, like it's been for a year. No activities, no going to the ball games, no going to the movies. And so I think they are coming around now and understanding. But the most important factor is that they got to understand and look around, because I don't know anybody in the younger generation now that don't know some family who have lost someone to COVID.
Mm-hmm. Mm-hmm.
And by that, they're beginning to wake up and look and say, this is a serious virus.
Right. Yeah, I agree. Thank you. Thank you for that
I'd like
response.
to,
And go ahead.
if
Go ahead,
if I
Dr.
may,
Cook.
I'd like to piggyback. I think Coach hit on something extremely important, and maybe isn't emphasized enough, and that is young folks. Um, and I say young, and I don't mean it in any disparaging way, but tend to look at the here and now, and talk about and live for their social life. Well, by Coach saying what he said, I think we kind of miss we kind of miss the target sometimes when we talk about other things and we don't emphasize that for you to get back to your social life, for you to get back to your social norm, it's going to be important that you participate in this effort, that you get vaccinated, that you so that you can go to parties, so you can have your barbecue, so there's a very important piece of messaging that I hadn't thought of in a way that coaches just touched on it, and it's important to use that messaging to get to the people that you want to hear it. You can talk all day long if you're not talking with a message that emanates some kind of emotion with that individual. That person is likely not to receive it as well. So, Coach, I really think that is a very important point of focus for our younger individuals. And I would say, let's get back to norm. Let's get vaccinated. Let's get back to partying. Let's get vaccinated. Let's get back to visiting grandparents. Let's get vaccinated. Those kind of messages, I think, would be very important. I think, and I thank you, Coach, that you really enlightened me on that thought.
Thanks, Doc.
All right. Coach Williams, I'm going to piggyback onto that question and your comment just a bit. As we know, last year, it was actually right around this time, maybe in March. I'm a big, as many of us are in North Carolina and on Tobacco Road, we're big ACC fans. And as we know, the ACC tournament was canceled and many athletic activities were canceled. We're finally now getting back to a point where some of these athletic activities are beginning. I know for a lot of college athletes, or excuse me, high school athletes are thinking about, hey, if I can't get out here and showcase my talent, that could prevent me from getting a scholarship or my opportunities and to go to college. What are your thoughts? And again, this does not have to be a medical response, but what are your thoughts around students playing sports during this pandemic?
My thoughts is that I really have a little problems with it right now as the coach, because of the fact that I don't think we have a system that is strong enough to understand. See, young people come from all backgrounds, and some of them cannot get or will not get what others get. And I don't want to make it look like a racist thing or whatever, but we have kids coming from all different backgrounds in sports. And if something happened to a kid in Southeast Raleigh with the virus, and something happened to a kid in North Raleigh with the virus, the kid in North Raleigh is going to be taken care of quicker than the kid in Southeast Raleigh. The kid in Southeast Raleigh is going to take the virus to his community and his family, which have doubts about the vaccine. So unless we can get some kind of system where we can say, okay, put the kids in some kind of lockdown, have some kind of testing every day, and get the results back within the next 20 or 30 minutes, then I'm against it. But if we don't have that, I'm with it. But if we don't have that, I'm against it.
Okay. All right. Thank you. Brother Cook, Dr. Cook,
Yes, sir.
if you could give us maybe from a medical standpoint, as we know, many schools now are continuing with sports, not only at the high school level, but obviously the college level and the professional level. Do you have any thoughts about continuing with sports during this pandemic?
Well, yes, I do. In fact, I want to piggyback on one of the statements that coach has made, and that is the rapid testing. Rapid testing is out there. It comes in many forms. I do rapid testing in my office where I get the results back in 15 minutes, 20 minutes from an oral swab. If we're serious about keeping the athletes safe, you can't just think about athletics in the bigger form, the game. You have to think about each individual participant. And then you have to think about the audience. And the participants then, like we've seen in the upper echelons of sports in college basketball now, it's happening more, but certainly in professional sports, these guys get tested every 2 days, every 3 days, and then they get taken out of the arena if they're positive, and of course, surveillance of their teammates. Well, I think coach really had it right in terms of the schools, what schools are doing that and what schools are not. If you're not prepared to do that, why are you exposing these 17 and 18-year-old kids to a continuous flow of danger? And it is not the young person that evades all of the problem with COVID-19. We've seen 16, 12, 8, 10-year-olds die from COVID-19, but he mentioned something earlier that needs to be said too. The COVID-19 is a vascular virus. It attacks the blood vessels. There's now evidence, even after a year, that even after you get over COVID-19 and you're feeling well, and by all other measures doing well, the virus still have inflicted a long-term injury to your blood vessels. So if you're 18 now and you planning on going pro as an athlete in 3 years in the National Football League, you may not be able to, because we don't know the time period where those vascular injuries may actually become devastating. We don't know when they'll become limited. Will they take away some of your athletic prowess? I mean, what is out there is a lot of questions. So I think that, again, if they don't, it's hypocritical if you are exposing these kids and not protecting these kids. If you're able to protect them, then we're talking about a different ball game. And in order to protect them, you have to test them frequently. You have to hold them out. If they're not there, you have to do the quarantine as everyone else in our society. It's just a microcosm of a larger problem, but it's better protect. You can better protect those athletes than you can the general public from exposure. That's where my thing is. That's where my thought process is, and that is, if you're able to do it, yes. If you're not able to do it and protect those athletes because you may be exposing them to detrimental harm in the future, then don't do it.
Gotcha.
Thanks, Dr. Cook. We all should be on the same playing field, right?
Exactly.
Great. Thank you. That's great information. Greer, did you have a response?
I did. I just wanted to follow that up again in complete agreement with Coach Williams as well as Dr. Cook in that athletes, especially on college campuses, are an important part of the campus environment and atmosphere. We want to make sure that they're protected, as for so many sports, especially the revenue generating ones, those athletes come from mainly minority backgrounds or marginalized backgrounds. And so it's important that we're keeping them safe and making sure that we understand that while they're a backbone of our community and generating income for our universities and colleges, it is critical I'd say that they are also protected. And so to just tie in, as we are running low on time, one of the comments from the chat, a few of the comments are asking, how is the education or college experience different because of this virus? I will say here at UNC Chapel Hill, I'm living off campus, so not on campus, and they're still requiring us to test once a week. And so Dr. Cook hit on that importance of testing and that availability of testing. And so I think that's an important point when we're looking at how to reduce this spread. If you live on campus at UNC Chapel Hill, you are required to get tested at least twice per week. Otherwise, you may be disenrolled from classes. And so young people are taking this seriously. And if they're not, these universities have wised up and are making us take it seriously. And so I think that is positive. Of course, all of our classes are online. And while we'd like to be in person, I understand, and so many of my peers understand that for the safety of all of us, online classes is the way to go right now. So it's frustrating, and sometimes it increases anxiety, but it's just where we are right now. So taking these vaccines when you're eligible, as well as making sure to get tested, especially if you think you've been in contact with someone that may be carrying this virus, this vascular virus, as Dr. Cook mentioned, is so crucial right now as we continue to just plow through this pandemic.
Okay, thank you. Thank you. Okay, as you mentioned, there are quite a few questions floating around out there. So, Ms. Josephine Rutledge, do you have another question that we could field before we get ready to close?
Sure. This question is for Greer. The question is, how has the pandemic interrupted your college life?
That's a great question, and allow me to expand upon that. It definitely has been an interruption. And so like I mentioned, it is tough. It's definitely not what I expected this semester to be like, but we've been here on the college level for a year now. And so it has definitely taken away opportunities that usually we would have been afforded. And it's been tough to see my classmates and my friends either from a distance or on the computer. But again, it's what we have to do right now. And so we're finding ways to continue to be interactive in our courses and engage with the material, as well as see our friends while not putting them at risk. And so I do hope that my peers or any young people on the call continue to stay safe, to stay cautious, and to try and find areas where you can have fun still as a college student, as a young person, while not putting your family members or friends at risk. And so that can look like doing more online experiences or going outside and, spreading out and talking with masks. There are ways to still continue living, but it has definitely interrupted that college experience. And so that's a great question. And I hope by doing everything that we've talked about tonight, we're able to mitigate the spread of this virus and get back to some sense of normalcy soon.
Oh yeah, I know we all want that. We definitely do. We are getting closer to the top of the hour, but I do believe we have at least time for one to maybe two more questions. It just kind of depends. Is there yet one more question that we have?
Can I make a comment, Ms. Moderator?
Sure, go ahead, Dr. Cook.
For young people and for those who are not in the queue to get their vaccine, let me advise you of something that many of my patients have done, and I give them this advice. Call your pharmacy. Pharmacies now, especially CVS and Walgreens, and even some of the smaller pharmacies now have the vaccine. Call them and ask them to be put on the missed vaccine dose list. So people will actually sign up for two or three sites for the vaccine. They'll go ahead and get their vaccine, and they'll sign up for, let's say, CVS. Ask them to be put on the list for that person, because we shouldn't be wasting any doses. And if they miss that appointment, they can call you. You can be on call, and independent of what list you're on or your age, you can actually get into the queue to receive those missed vaccine dosing that someone would not have kept their appointment. Just a thought.
Yeah, that's a great point. I know I've been doing that, and it's been a discussion I've had with others. So that is a great point. Thank you for sharing that. Well, we do still have time for one more question, if there is one more question from the panel.
Yes,
I mean, from the audience.
There is a question that concerns people that how do they know that they're getting the actual vaccine from the vial and that there's not something nefarious going on?
Okay. Well, we're going to keep you working, Dr. Cook. We're going to keep you working. If you could help us out with that would be great. I have some ideas on that, but of course, I'm not the medical professional.
Well, one thing is if you want champagne, you have to order it. You have to get it from Paris. Now, what does that mean? If you go to reputable entities to get your vaccination, you are 99.9999% likely to be getting it. Don't go to the corner grocery store, so to speak, to get your vaccine. Okay, UNC, Duke, we have places that are sponsoring these events. Don't go to a shade tree mechanic to get your car fixed. And by not doing that, you're highly likely, and I'd almost say 100% likely, to be getting the proper dosing and the proper method of getting injected.
Yeah, thank you. I love that shade tree mechanic. I use that myself sometimes, so thank you. We do have just, looks like this will be the last question, and then we'll have our wrap up. Is there one final question from the audience that we would like to have answered? I think we have such great questions. I hate for anyone's question to not be answered, but we are getting low on time.
I think the last question would be from a person who asked that there are currently 2 vaccines authorized and recommended to prevent COVID-19. Is there one that is preferred or better with less side effects than the other?
Okay. I want to answer that one myself, but I know I'm not a medical professional. So Dr. Cook, you go ahead. I'm sure you're going to say what I'm thinking.
I think you can answer the first, the best vaccine is the first one available to you. The first one available to you. There's what both of them have equal efficacy. The new one that's coming out that should be approved and available by the middle of the month, although it's a single dosing, whichever one you can get first is the best one.
Yeah, I think that's straight to the point. I agree. Well, Ms. Ida, we're going to let you have a few closing comments, and then I'll have a closing comment, and we'll be done.
Thank you, Mr. Lambert. Chum Josephine, who is our vice president, is going to offer those tonight.
Oh, sorry about that. Thank you.
No problem. Good evening again, everyone. We want to thank you for joining us in this second session for the 3-part series of the power of information concerning the COVID-19 vaccine. We want to especially thank our panelists, Dr. Cook, Coach Williams, and Gear Webb. We've gotten some valuable information here tonight. Fear can be it can be powerful and it can be all-consuming. So when you find yourself fearful of anything, seek information from those people that you trust and that are knowledgeable of whatever it is you're fearful of. 2 reminders that we want to leave you with, and then we'll give it to Mr. Lambert, is that continue to practice the 3 W's. Wear your mask. Make sure that that mask is covering your nose and your mouth. Wait. Make sure that you're practicing social distancing. Maintain that 6 feet apart distancing. And also the last one, wash your hands more often than you have in the past. And the next reminder is that the 3rd part of this series will be available March 25th at 7 o'clock. So again, thanks to the panelists and for everyone who's come on Zoom.
Great, thank you. Yes, as I close, again, I'm Eddie Lambert, the president of the Alpha Phi Alpha Fraternity Incorporated, Phi Lambda chapter, seated in Raleigh, North Carolina, providing service, leadership, scholarship, and service to Wake and Johnston counties since 1926. Again, thank you to the audience for joining us this evening. Thank you for the great engaging questions. Those have been awesome. I want to thank our panelists, Coach Williams, thank you. Greer Webb, thank you. And of course, thank you, brother, Dr. Charles Cook. Thank you for your time this evening and joining us and answering these questions. As we mentioned before, I know there are many sessions that have been going on, and we want to, again, tell everyone thank you for joining us tonight. And hopefully, I do believe that you were able to get not only some medical information, but also some information from folks who are valued members of our local community to help you gain that trust that you need in order to make an informative decision. Thank you to our sponsors, Delta Sigma Theta, Sorority Incorporated, the NAACP, and of course, Chums. So again, thank you, and we look forward to seeing you next month, March 25th at 7 p.m. Have a great night.